So if you're watching this video, it means we've talked about the fact that you need a labral repair. The labrum is the soft tissue bumper that runs around the socket of your shoulder, which is called the glenoid, and it helps to control stability of the ball, which is the top of the humerus, on the socket. This labrum is important for both stability and also for pain, and so you may have been told you need the labral repair either because of persistent pain or because you've had instability or dislocations that have recurred. The surgery is done arthroscopically, which means we go in through very small portals or incisions in the shoulder. I use a camera and I use small plastic anchors that go into the bone and allow me to sew the labrum back down to the bone. This is done as an outpatient surgery. You'll come in the morning, you'll go home that afternoon. The whole surgery takes between 60 and 90 minutes, and you're sedated through an IV sedation, but the shoulder is numbed up with what's called a local or regional anesthesia. That means there's no breathing tube, no general anesthesia, although you'll feel like you're sleeping because of the sedation. In the recovery room, when you wake up, you'll have a numb arm and you'll have a sling on your shoulder, and that sling will stay on for the first 6 weeks after surgery. During the recovery period in the recovery room, you'll be taught how to do certain exercises with your arm, which you'll do once you go home. You'll be sent home with a numb arm, and once the numbness wears off, you'll be given good pain medication to take for the first 2 to 3 days around the clock. Thereafter, you'll need it most of the time at night and maybe 1 or 2 pills during the day. You'll start physical therapy usually about 1 week after the surgery. You'll see me at 10 days, I'll take the sutures out, and then regular intervals between 4 and 6 weeks, every 4 to 6 weeks thereafter, where you'll see me and we'll talk about range of motion and strength and see where we need to progress in terms of recovering you fully. Around 3 months, you'll see me back. At that point, again, we'll check your strength and your progression, and we'll start what's called a return to sport program, where you'll start to do more sport-specific exercises at physical therapy. And once your strength is fully recovered, around 5 to 6 months, you'll be back to full sport and activity.